I'm a haematologist. I work at Epworth Healthcare and Peter MacCallum Cancer Centre, and I'm also one of the founders of the Snow Dome Foundation. And you know that this virus is around us, and it affects, the reason you're listening in is that you're likely affected by cancer, particularly blood cancers, and unfortunately they don't stop for the virus. And we still need to keep researching. We still need a lot of resources for the next generation of treatments for the blood cancers, and that's where the Snow Dome Foundation comes in. So if there's an opportunity that you could support the Snow Dome Foundation, it would be greatly appreciated. Secondly, I'm wearing my College of Pathologists tie again today, and I'm going to kick off by talking about the concept of a virus. So I've been chatting to patients this week, and in fact, one of the key things that has been said to me is that what's the difference between viruses and bacteria and funguses? And so viruses are very different to bacteria. Viruses get into the body and they actually overtake some of the machinery that our own body uses to replicate. So bacteria, for example, will get into the skin like cellulitis, and then it will multiply itself and spread as that bacteria multiplies on its own mechanisms, whereas the viruses use the genetic structure of the patient itself. So viruses can affect different types of animals. So that's what's strange about this coronavirus, is that we think it probably was derived in a different host and it's somehow mutated. Now, the flu virus is very closely related and it causes us similar symptoms, but it has the capacity to mutate and become new or seen as new to that particular patient. So when we talk about vaccines, the concept here is that you're taking a part of the virus, like taking a rag to a bloodhound and saying, attack. So the body starts to develop its own antibodies, which stay with the patient. So shortly after you're born, you get vaccines for measles, mumps, rubella, and then polio, and then later in life, tetanus. All of these are vaccines which are teaching the body to recognize it when they actually come across the real stuff. But you can also be self-vaccinated. So if you get the flu itself from somebody else, you'll become relatively immune. And so the concept here is that when we talk about immunity to the coronavirus, it's either developed from getting it yourself, at the actual infection, and then being immune. And the other is by the use of a vaccine, if it can be developed, just like the flu vaccine that we get every year. There is challenges to producing vaccines. So we can't have a vaccine for every bacteria. It's just not technically possible. Sometimes it's just the body won't induce an immune response to a vaccine, because the concept of a vaccine is getting part of that component, not all of it, because we don't want to infect the person. So there's no guarantee that there will be a vaccine, and it will take some time. So we have to accept that it's going to take at least another year for us to have a vaccine. That has huge implications to travel, I think, because we're seeing coronavirus all around us in the rest of the world. We're on this tiny, or rather big island, and isolated, and it's going to have major implications for overseas travel. So people are asking me, when can we travel? I don't know, but it's a question of whether we have a vaccine or when the world is immune. Could be a long time. So social isolation is critical. Right now, we're incredibly lucky in Australia. The government has put in clear guidelines. People are following. The numbers of new cases are rare. What's going to happen over the next few months when social distancing gets lessened is going to become is unknown, and there is going to be waves where there is more of this around. So you're going to need to continue to keep safe distancing. Reducing social isolation and safe distancing are not the same thing. You need to be aware when you're going out, when you can't control distancing, and you need to be very careful. So The issue with this virus is that what we've learned in the last month is that overseas, the biggest risk factors are actually not the underlying disease like cancer. In fact, a lot of cancer, it seems, including blood cancers, is relatively underrepresented, which is telling us two things. First of all, cancer patients, blood cancer patients, are doing the right thing. They are socially distancing. They are isolating, so they're not in. So they're keeping themselves safe. So it works. The second thing is that the second thing that we've discovered is that the immune system that is in most patients with blood cancer still remains relatively strong. So please don't be paranoid. You are going to have to live with this, but social distancing is going to be critical with everybody around you. It's reassuring that patients, we're not seeing lots and lots of patients with specific diagnoses in the hospitals. And so you need to follow your doctor's instructions. You need to be constantly aware of social distancing. And of course, it's really important. The government has provided this app, and I'll put it in the COVID Safe app. This is critical. We're very lucky in Australia that we've only got small numbers of people with the condition. If that starts to grow, it's going to occur in pockets. It could be in your suburb, or it could be in New South Wales. It could be anywhere, but it could be in Northern Territory. It's going to occur in pockets, and this app will help that and help put out those little bushfires very quickly. It really does upset me when people are talking about the fact that it is affecting our rights. You've just got to think about the 60 nurses and doctors that died in Italy, the 80 nurses and doctors that died in the UK, basically going there every day to see patients, look after patients with this. If we can't use an app to help reduce the numbers and stop people coming into hospitals, then I don't think we're serving our fellow members very well. So after that little rant, the key thing is that you remain at relatively low risk. Things are going to change over the next few months as social distancing becomes less. Use the app. I've had some very specific questions, which is about immunity. I think one of them is a very good question, particularly about, do patients with blood cancers develop immunity as well as other people? It will vary, and we don't actually know that answer yet, except to say that most of blood cancer patients now do develop immunity to most of the vaccines. Different vaccines have different strengths. So for example, a measles vaccine will last most people a whole life, and it will last forever and rarely be lost. Whereas a vaccine for tetanus often has to be boosted, which you all know about, every few years. What will the coronavirus vaccine be like, strong or weak? We don't know, and there may be a number of them. So maintaining resistance is likely, but unknown. Another question about delaying transplantation. What's happening is that transplant centres are loosening their criteria, now getting back on board. It's a matter of really speaking to your doctor. Autologous transplants for myeloma are starting to be used more, and also for lymphoma. Allogeneic transplants are a case-by-case basis, but it is actually there have been transplants been going on all along in the last month. So there is no single answer to that. Delaying transplants for specific conditions, it really depends on the conditions. But for example, one question about myelofibrosis, yes, very common to delay a transplant for 6 months, 12 months, 18 months. Similarly for multiple myeloma, it can be delayed. Testing is important. The testing will tell you what's going on at a given point of time. We really are looking for a test that will be able to detect the disease as early as possible. So when people have got the earlier signs, that's the tough one. You can often detect it. We can now easily detect it in people who have the condition, people who are asymptomatic carriers, yes. But if someone's been exposed 2 hours ago, we wouldn't know that at this point. It does take some time in the body. So testing may need to be repeated on the same patient on numerous times. So I think I've answered all of the questions for this week. The take-home messages are that you need to follow the government guidelines. We're very fortunate at the moment. The risk is very low, but we need to loosen off, and there will be pockets. How do we deal with that? Social distancing, unload the app, and stay safe. Last of all, a reminder, blood cancer continues on. If you can support Snowdome in any way at all, it would be much appreciated. So we'll see you again in the next few weeks, and please stay safe. Thank you.